Hello everyone, I am Shomukantagiri. Welcome to my channel. So today I will discuss 10 important MCQs on cholinergic drugs. Okay, so this is my brief introduction. So let's start the topic. Okay, so first question is the cardiac muscarinic receptor. Okay, cardiac muscarinic receptors are option A, are of the M1 type, option B, are of the M2 subtype, option C, are selectively blocked by pyrazipine. Okay, option D, function through the PIP2 IP3 DAC pathway. Okay, you can pause the video and answer yourself. Okay, so here see cardiac muscarinic receptors. Muscarinic receptors are of three types: M1, M2, M3 generally. Okay, so M2 is present in heart. Okay, so cardiac muscarinic receptors are of M2 subtype. That will be your answer. Okay. See, cholinergic receptors are of two types, muscarinic receptor and nicotinic receptor. So M1, M2, M3, these three types of muscarinic receptors are present in our body. M1 present in gastric glands, M2 present in heart, and M3 present in visceral smooth muscle, iris, exocrine glands, etc. Okay. So these three subtypes of M receptor or muscarinic receptors are widely distributed in our body, and M1 is GQ protein coupled receptor. Okay, M2 is GI protein coupled receptor and M3 is GQ protein coupled receptor. That means M1 and M3, these two are the G protein coupled receptor and GQ subtype G protein coupled receptor. Okay, whereas M2 receptor is GPCR, that means G protein coupled receptor, but here G protein is GI. Okay, so that's why the difference between M1, M2, M3 is there. That is functional difference. Okay, that means whereas M1, M3, these two receptor M1 and M3, these two receptors are actually works through IP3 DAC pathway. Okay, whereas M2 receptor, here GI protein is involved. That's why potassium channel opening and decreasing the amount of CAMP is the main action of your M2 receptor. Okay, so if you want to learn GPCR or G protein coupled receptor in detail, then I am giving the link of my video. Okay, another video, you can watch the video. Okay, so effect, what is the effect of M1 receptor? Acid secretion. M1 receptor is involved in case of acid secretion. Why? Because see, M1 receptor is present in gastric gland. Okay, and it's a type of receptor where GQ protein is involved and IP3 DAC pathway is happening there. Okay, when M1 receptor is activated, then IP3 DAC pathway will be open and calcium 2 plus ion will be released from the sarcoplasmic reticulum. Okay, so what is the role of calcium 2 plus? Okay, calcium 2 plus actually vasoconstriction, and that's why acid will be secreted from the gastric gland. Okay, and the effect of M2 receptor is present in heart. Okay, and it's a inhibitory receptor. That means inhibitory protein is there, GI protein. Okay, that's why heart rate and blood pressure will be decreased when M2 receptor will be activated. Then heart rate and blood pressure will be decreased. Okay, in case of M3 receptor, see, M3 receptor again GQ protein coupled receptor. That's mean calcium will be released from the sarcoplasmic reticulum and it will contract the visceral smooth muscle and pupil, and secretion of the exocrine gland will be increased. Okay, so I hope the three receptor M1, M2, M3, these are clear to you now. Then coming to the next question. Okay, cholinergic muscarinic receptor stimulation produces the following effect except. Okay, so the question tells about what is not the function of your cholinergic system. Okay, upon activation of cholinergic system, what is not the function? See, option A sweating, option B rise in blood pressure, option C bradycardia, option D urination. See, sweating is the action of or effect of cholinergic system activation. Okay, number C bradycardia. Bradycardia means decrease in heart rate. Okay, we have already seen that M2 receptor is present in heart, M2 receptor is present in heart, and it's a GPCR protein, a GPCR type of receptor, and here GI protein is involved. GI protein shows inhibitory action. Inhibitory action means it will produce reduced blood pressure and it will produce reduced heart rate. Okay, so here your correct option will be rise in blood pressure. See, what the question is asking about. question is asking about cholinergic muscarinic receptor stimulation produces the following effects except. सो ब्लड प्रेशर तो इंक्रीज नहीं होगा ना, M2 रिसेप्टर एक्टिवेशन होने के बाद ब्लड प्रेशर तो इंक्रीज नहीं होगा, सो इट विल बी योर आंसर. सो ऑप्शन बी इज नॉट द इफेक्ट ऑफ द कोलिनर्जिक सिस्टम, दैट्स व्हाई इट विल बी द आंसर इन केस ऑफ दिस क्वेश्चन. ओके, सी दिस इज द action of parasympathetic system and this is the action of sympathetic system. Okay, sympathetic system means adrenergic system and it is the parasympathetic means cholinergic system. Okay, so heart, bronchus, GIT, bladder, pupil, glands. Okay, so among these 6 sides, okay, only on heart parasympathetic system has the depression or depressing effect. Okay, whereas in case of bronchus, in case of GIT, in case of bladder, in case of pupil, in case of glands, it all stimulates. Okay, parasympathetic system stimulates bronchus, that means causes bronchoconstriction, stimulates GIT, stimulates your bladder, that's why it increases the urine outflow. Okay, in case of pupil it causes meiosis. Okay, in case of glands it causes stimulation, that means sweat secretion, gastric acid secretion, all these are happening through the parasympathetic system activation. Okay, and the sympathetic system has the opposite of it. Okay, opposite of it. In case of heart, sympathetic system only stimulates the heart, whereas in case of bronchus, GIT, bladder, pupil, glands, it all reduces the action. It all reduces its action. Okay, so clearly you can understand the effect of actions of parasympathetic system and actions of sympathetic system and the difference. Okay, so coming to the next question. Which of the following secretions is not stimulated by acetylcholine? It's also an important question. Okay, you can see TR, bile, pancreatic juice, sweat. Okay, see, bile is not stimulated by acetylcholine. Okay, so here your answer will be bile. Whereas TR, pancreatic juice and sweat, all these 3 are secreted by acetylcholine. Okay, coming to the fourth question. Pilocarpin is used for. See, pilocarpin is used for what is pilocarpin? Pilocarpin is a directly acting cholinomimetic drug. Okay, directly acting cholinomimetic drug and it's an alkaloid. Okay, so options are glaucoma, paralytic ileus, then urinary retention and all of the above. See, pilocarpin is used generally in open angle glaucoma. It's a third line drug in open angle glaucoma, so your answer will be glaucoma. See, okay, so coming to the some in detail points on pilocarpin. See, pilocarpin is a directly acting cholinergic alkaloid. It's obtained from the leaves of Pilocarpus microphyllus. It's important. Okay, it has prominent muscarinic action and pilocarpin causes marked sweating, salivation, increased in other secretion. Okay, so as it's a cholinomimetic drug, it will produce the actions similar to the acetylcholine. Okay, that is quite similar. And pilocarpin is used only in eye as 0.5 to 4% drop. It's a third line drug in open angle glaucoma. So it is the use of pilocarpin. Okay, coming to the next question. NEOStigmine is preferred over physostigmine for treating myasthenia gravis because, okay, options are: it is better absorbed orally, it has longer duration of action, it has additional direct agonistic action on nicotinic receptors at the muscle end plate. Option D, it penetrates blood-brain barrier. See, first understand what is myasthenia gravis. Myasthenia gravis, it's an autoimmune disorder. Okay, it's an autoimmune disorder where due to the development of the antibodies directed to the nicotinic receptor at the muscle end plate. That means it's your muscle end plate and here nicotinic receptors are present. This is your nicotinic receptor. Okay, I have taken this image from KD Tripathi. Okay, so this is the nicotinic. These are the nicotinic receptors present in the muscle end plate. You can find here. Okay, this. Okay, and acetylcholines are secreted from the presynaptic neuron. Okay, this is acetylcholine. Then this acetylcholine is going to bind on the nicotinic receptor on the nicotinic receptor present in the muscle end plate. But in case of myasthenia gravis, and a specific antibody is produced which blocks the binding portion of the nicotinic receptor. Actually, it attaches with the nicotinic receptor, and nicotinic receptor antibody complex is formed. That's why this acetylcholine, which is secreted from the presynaptic neuron, has the lesser chances to bind with the nicotinic receptor. Why? Because there is the reduction in the number of free nicotinic receptor in the muscle end plate. Okay, so that's why structural damage of the neuromuscular junction happens. That is the your myasthenia gravis. Okay, here adrophonium test is used for detection or diagnosis of the myasthenia gravis, and neostigmine is generally used for your treatment purpose. Okay, and coming to the question, neostigmine is preferred over physostigmine. Why? Now, because here option C will be your correct. Okay, why? It has additional direct agonistic action on nicotinic receptors at the muscle end plate. This will be your answer. So let's a quick look. Okay, difference between the physostigmine and neostigmine. See, physostigmine is obtained from the Physostigma venenosum. कैलाबर बीन जो होता है ना, वहां से बनता है ये physostigmine. Okay, so physostigmine is obtained from natural source, whereas neostigmine is obtained from synthetic source. That's the major difference. And physostigmine is having tertiary amine. It's a tertiary amine derivative, physostigmine, whereas neostigmine is a quaternary ammonium compound. In case of physostigmine, CNS action is present, whereas neostigmine, no CNS action is there. Okay, these are the very important differences. Okay, in any exam, you can expect a question on these differences. Okay, it's quite common. And physostigmine is used in case of glaucoma, whereas neostigmine is used in case of myasthenia gravis. So we have learned from this question. How many points we have learned from this question? First of all, what is myasthenia gravis? We have learned. Then treatment of myasthenia gravis. Neostigmine is used for the myasthenia gravis. Okay. Detection. For the diagnosis purpose, we use adrophonium. Okay. And what is the difference between the physostigmine and neostigmine? We have learned all these things. Okay. Coming to the next question. Which is the most important drug in the treatment of organophosphate poisoning? It is also a very important question. Organophosphate poisoning जो होता है ना, which of the following is the specific antidote? See, options are atropine sulfate, pralidoxime, diazepam, adrenaline. See, these two can't be your answer. Okay, but option A and option B will irritate you. Okay, because in case of any book, these two options are written for the treatment of organophosphate poisoning. But if these two are given in the same question, then answer will be your atropine sulfate. क्योंकि in practical purpose, atropine sulfate is generally used for the treatment of organophosphate. So organophosphate होता क्या है? Organophosphate is the anticholinergic drug. What is anticholinergic? First, learn about what is cholinergic. See, cholinergic और acetylcholinergic जो भी होता है, ठीक है, cholinergic and acetylcholinergic वो जो होता है ना, actually it breaks down acetylcholine into two parts, choline and acetate. Okay, so actually acetylcholinesterase and cholinesterase, these type of enzymes breaks the acetylcholine and inhibits the action of acetylcholine. So acetylcholine का जो स्ट्रक्चर होता है वो ही ब्रेक हो जाता है, तो acetylcholine काम कैसे करेंगे? ठीक है, सो acetylcholinesterase जो एंजाइम होता है ना, उनका काम ही है acetylcholine को तोड़ दो. ओके, एंड एंटीकोलिनेस्टेरेज कौन होता है? एंटीकोलिनेस्टेरेज जो होता है ना, वो होता है एसिटाइलकोलिनेस्टेरेज जो एंजाइम होता है उसको ब्लॉक कर दो. तो क्या होगा? एसिटाइलकोलिनेस्टेरेज जो एंजाइम होता है उसका रिडक्शन होगा बॉडी में, एंड एसिटाइलकोलिन का जो कॉन्सेंट्रेशन है वो बढ़ जाएगा, उसका कॉन्सेंट्रेशन इंक्रीज होगा. ओके, सो एंटीकोलिनेस्टेरेज पॉइजनिंग कब होता है? जब एसिटेज जो एंजाइम होता है वो ज़्यादा हो जाता है आपका बॉडी में, ठीक है। जो इंसेक्टिसाइड होता है ना जो मिलता है वो एंटीकोलिनेस्टेरेज एंजाइम होता है, ठीक है, एंटीकोलिनेस्टेरेज ड्रग होता है। सो वो एसिटाइलकोलिनेस्टेरेज के एस्टेरेज जो एसिटाइलकोलिनेस्टेरेज जो एंजाइम होता है उनको काम नहीं करने देता है, ठीक है। तो यहाँ से क्या होगा, इन केस ऑफ यू आर टेकिंग एंटीकोलिनेस्टेरेज ड्रग इन ह्यूज अमाउंट, then the amount of acetylcholine will be increased in your body and blurring vision, salivation, sweating will be there, blood pressure will be reduced, weakness, respiratory paralysis will be there, okay. And specific antidote for the treatment of anticholinergic poisoning, atropine is there, and cholinesterase activator pralidoxim is also there, क्योंकि pralidoxim जो cholinesterase जो एंजाइम होता है ना, यू आर टेकिंग एंटीकोलिनेस्टेरेज ड्रग, ठीक है, यू आर टेकिंग एंटीकोलिनेस्टेरेज ड्रग एंड दिस एंटीकोलिनेस्टेरेज ड्रग इज गोइंग टू रिड्यूस द अमाउंट ऑफ एसिटाइलकोलिनेस्टेरेज एंजाइम. एसिटाइलकोलिनेस्टेरेज एंजाइम इज रिस्पॉन्सिबल फॉर द ब्रेकडाउन ऑफ एसिटाइलकोलिन, ओके. एंड कोलिनेस्टेरेज जो रिएक्टिवेटर होता है उनका काम होता है ये जो एसिटाइलकोलिनेस्टेरेज जो एंजाइम है ना उनको फिर से जगाओ, रिएक्टिवेट करो फिर से. तो क्या होगा, बॉडी में एसिटाइलकोलिन का जो अमाउंट है वो कम होगा धीरे धीरे, ठीक है. दैट इज द एक्शन ऑफ योर प्रेलिडॉक्सिन. बट ऑप्शन में दोनों ही है, ठीक है, एट्रोपिन सल्फेट भी है एंड प्रेलिडॉक्सिन भी है. तो आंसर होगा आपका एट्रोपिन सल्फेट, ओके, माइंड इट. देन कमिंग टू द नेक्स्ट क्वेश्चन, नियोस्टिग्माइन इज बेनिफिशियल इन कोबरा एनवेनोमेशन बिकॉज, मतलब कोबरा बाइट जो होता है वहां पे नियोस्टिग्माइन देता है as a treatment. Why? Because option A, it binds to and inactivates cobra toxin. Option B, it reverses coma due to cobra toxin. Option C, it encounters the cardio-depressant action of cobra toxin. Option D, it antagonizes the paralyzing action of cobra toxin. See, option D will be your right answer because neostigmine antagonizes the paralysis action of the cobra toxin, okay. Coming to the next question, dorzolamide. Okay, what is dorzolamide? Dorzolamide options are topically applied ocular carbonic anhydrase inhibitor, second generation sulfonyl urease. Then option C, topical sulfonamide antibacterial. Option D, luminal amubicide. See, dorzolamide is a drug which is carbonic anhydrase inhibitor like acetazolamide, but it can be given through the topical route, okay. It is used in case of glaucoma also, okay. It is used in case of glaucoma also. Topical eye drops are available in the market. See, what is glaucoma? Learn some points about glaucoma, okay. So in this video I am not discussing only the answers, I am also explaining the answers, okay. That is very very important for your exam purpose. See, what is glaucoma? Glaucoma is the increased amount of ocular pressure. आपका जो आई जो होता है ना वहां पे एक्वस ह्यूमर होता है, ठीक है, एंटीरियर सेक्शन, ठीक है. तो उनका ज्यादा सिक्रेशन होगा, उनका सिक्रेशन बढ़ जाएगा और उनका जो आउटफ्लो है वो घट जाएगा. मतलब इन केस ऑफ ग्लॉकोमा योर ऑक्यूलर प्रेशर इज इंक्रीजिंग. हाउ इट इज गोइंग टू बी इंक्रीज्ड? क्योंकि सिक्रेशन ज्यादा हो रहा है. किसका सिक्रेशन? एक्वस ह्यूमर का. और आउटफ्लो जो होता है ना एक्वस ह्यूमर का आउटफ्लो भी होता है वो कम हो रहा है. दैट्स व्हाई द अमाउंट ऑफ एक्वस ह्यूमर प्रेजेंट in your anterior section of the eye is increased and it is going to increase the ocular pressure. Generally greater than 21 millimeter Hg pressure, generally greater than 21 millimeter Hg pressure is observed in case of glaucoma patient. Okay, so what will be the treatment approach for glaucoma? First, you can reduce the aqueous humor production. Number two, you can increase the aqueous humor outflow. Okay, these two are the approaches. Which drugs are going to reduce the aqueous humor secretion? Beta blockers, alpha 2 agonists, and carbonic anhydrase inhibitors like dorzolamide. And in case of aqueous outflow, increasing aqueous outflow. There are two types of aqueous outflow is there: trabecular outflow and uveoscleral outflow. Okay, latanoprost, a type of prostaglandin analog, bimatoprost. These two are going to increase uveoscleral outflow. That is very, very important. In case of trabecular outflow is increased by Martix and alpha 2 agonist. Okay, so I hope it is clear to you why dorzolamide, what is dorzolamide, and what is glaucoma, and what is the treatment approach of glaucoma, what are the drugs used in glaucoma. I hope it is clear to you. Okay, then coming to the ninth question, nicotinic receptor. See, nicotinic receptor is a options are GPCR, ligand gated ion channel receptor, nuclear receptor, tyrosine kinase receptor. See देखो, रिसेप्टर जो होता है ना, टोटल 4 टाइप्स का रिसेप्टर होता है हमारे बॉडी में, ठीक है. GPCR और G protein coupled receptor is there, ligand gated ion channel receptor is there, nuclear receptor is there, and enzyme linked receptor is there. Okay, tyrosine kinase receptor is a type of enzyme linked receptor. देखो, जो कोलिनर्जिक सिस्टम होता है वहाँ पे 2 टाइप का रिसेप्टर होता है. वन होता है मुस्करेनिक टाइप का रिसेप्टर, वन होता है निकोटिनिक टाइप का रिसेप्टर. ये जो मुस्करेनिक टाइप का रिसेप्टर होता है ना, ये सब GPCR का होता है, GPCR प्रोटीन. ओके, बट इन केस ऑफ निकोटिनिक रिसेप्टर ये होता है लाइगैंड गेटेड आयन चैनल रिसेप्टर. सो ऑप्शन बी विल बी योर राइट आंसर. ओके, ऑप्शन बी विल बी योर राइट आंसर. सी, कोलिनर्जिक रिसेप्टर्स निकोटिनिक रिसेप्टर होता है और मुस्करेनिक रिसेप्टर होता है. Muscarinic receptors can be further divided into M1, M2, M3, M4, M5. Okay, and M1, M2, M3, these three are your GPCR, whereas M2 is your GI protein coupled GPCR, and M1 is your GQ protein coupled G protein GPCR, and M3 GQ protein coupled GPCR. Okay, whereas nicotinic receptors are ligand gated ion channel receptor. Okay, coming to the last question. Storage of acetylcholine into synaptic vesicle is blocked by. Options are hemicolinium, botulinous toxin, vesamicol, and black widow spider toxin. This is also an important question. Okay, see, your answer will be vesamicol. Okay, why? Carefully see the diagram. Okay, for the synthesis of acetylcholine, acetyl coenzyme A and choline is essential. Okay, choline uptake of choline into the into the neuron is blocked by hemicolinium. Okay, after formation of acetylcholine, it should be stored in the vesicle, synaptic vesicle. The process of storing into the synaptic vesicle is blocked by vesamicol. Okay, it's blocked by vesamicol. Whereas after storing into the synaptic vesicle, upon activation, it will release this acetylcholine into the synaptic cleft. Again, this process of release is inhibited by botulinum toxin. Okay, these 3 inhibitors are very, very important for cholinergic system. So this is the end of our video. I hope all of you like the video. Please like, share, and subscribe our channel. Thank you.